Hi, and welcome to Healing Peak Regenerative Medicine's Longevity channel. And today I want to talk about to stem cell or not to stem cell. I just spent the last weekend in Scottsdale, Arizona at a regenerative medicine conference, and we discussed, the term stem cell, the use of stem cells, where we get them, how they're harvested, and really what's going on. And the FDA right now is really cracking down on people who are doing these therapies. And I felt pretty suspect about them for quite a while because it seems like there really aren't consistent results in patients. Some patients swear by them, they get amazing results, and, other patients get no results. And usually these therapies are no less than $10,000 per injection. And so, that's quite a bit of money for a 50-50 coin flip on whether or not you're going to get improvement. And what I offer here is also types of regenerative injection therapy, but also musculoskeletal and myofascial release, muscle release, all different types of therapies that 9 times out of 10 are going to get you the same result as if you were going to pay $10,000 for stem cells. So I just haven't been sold on the idea. And I'm happy actually about that because of what is happening now with the FDA and then also where stem cells are coming from and really what we're learning about stem cells in the process of doing them on people, which is sort of unethical, but the way that things usually get done both with drugs and procedures. So what's actually happening is private companies are using cord blood. And so it's not actually your fluid that's being injected back into your body, which is concerning because we don't actually know what that is going to turn into in that joint. It could turn into a teratoma, which is cancerous and has happened. And then the other place we're getting stem cells is from your adipose tissue, which is your fat tissue. And our bodies store, all of our toxins within this fat tissue. And we don't know, again, what that is going to turn into once we've injected into a joint or elsewhere. Most of the time, stem cells are used for pain therapy, to avoid knee replacement surgery, shoulder surgery, and that type of thing. And the third way that you can get stem cells is through bone marrow biopsy. And this is actually the only way to get active live stem cells from yourself back into your body. Once the the cord blood is frozen, cryo-frozen, they've actually been testing it and they don't find any actual stem cells in there. Adipose tissue will have some, and really what we're seeing is that the stem cells that get harvested from bone marrow are only living a day or two and actually probably aren't the active ingredient within the stem cell therapy. So the stem cell therapy now as a term has been deemed essentially archaic. It no longer should be used at all on the internet. It should no longer be marketed as a therapy that you can get because we're not actually using stem cells. Stem cells are not really what's doing the work. And what's happening actually is we're using everything else that's within that fluid. So there's a bunch of growth factors that are very powerful, and those are inside the solution in which we're injecting into the joint. And we don't really have a concentration standard or a measurable way to know how much of each growth factor is in which fluids and which ones they are, and if your body is at risk for developing some type of cancer, adverse reaction, or no reaction at all after you've paid a ton of money. And so it's really just not a standardized way to treat people. And so I just wanted to touch on this because I think a lot of people are getting, marketed to about stem cells when it's really inaccurate. It's essentially highway robbery. And I know that a lot of people would argue with me about this, but ultimately it's really about patient selection, which I go over extensively in all the other videos that I've made. And, the more healthy you are, the more likely you're going to get a good result. And if you are going to do it, most likely bone biopsy is the best way to go about doing it. And it should not be painful, and the bone biopsy. and should be, fairly easy to complete, but you should be seeing a physician that understands all these therapies, who has had extensive, experience with prolotherapy, platelet plasma therapy, trigger point injections, perineural injections, all kinds, neuroprolo. I mean, there's all these types of amazing therapies that really get the job done, that are way less expensive, more accessible to the patient, and as long as the patient's in really good health, they're probably going to get the same result for a lot less money than trying to go do a stem cell with no patient screening. And then also, I mean, it's not even the stem cells, right? So we really don't know what we're doing when we're doing it, which is a little bit, I don't know, for me that's a little bit scary. So I know there's a lot of hype around them, and I'm happy to discuss this further with anybody who is interested. And that's just kind of the scratching the surface level of some of the things that are going on out there right now. And I will keep you updated as I know more. And, as things become more standardized and safer as far as what we're now calling biologics. So now stem cell therapy really should be called biologics, because they're not stem cells. They're the growth factors and everything within there. So exosomes, biologic injections, that's really the term that should be used. And if you are considering stem cell therapy, I would really urge you to ask the important questions, do your research, attempt some other lower intervention therapies that have been widely researched and studied. And soon my new website will be launching, and there will be a research page where you can access the actual original research documents. And if you're interested in reading research, I kind of geek out on that because I want to know where people are getting their information, and I want to know what's safe and successful in patient therapy. So that will be available to you in the next couple of months, and I will keep you updated as things progress. But in the meantime, if you're interested in any prolotherapy or PRP for your joint pain, or for aesthetics, as in getting a facial, getting your skin to glow, treating sun damage, wrinkles, hair growth, I am happy to talk to you, and you can give us a call at 206-899-6000. I hope you all have a great Memorial Day weekend, and stay safe out there.